From the University of Washington in Seattle, the Institute for Health Metrics and Evaluation presents the announcement of the 2020 Roux Prize. Hello, and welcome to the presentation of the 2020 Roux Prize. I'm Angela Poe Russell. The prize is administered here at the Institute for Health Metrics and Evaluation at the University of Washington, and it honors those who have used health evidence in bold ways to make people's lives healthier. And the need for bold uses of health evidence has never been greater. COVID-19 has cost more than 1 million lives, and IHME's forecasts have become this indispensable tool for policymakers as they try to adapt to all the changes this pandemic has forced upon us. In fact, this program is one small example of those changes. It's virtual instead of the live galas that we've done in the past. But what hasn't changed is IHME's commitment to producing great science and recognizing innovation. In a few minutes, you'll get to meet some of the past winners of the Roux Prize, people whose contributions to the field of public health have helped make the world a better and safer place. And later, we'll announce the names of the remarkable scientists who have been awarded the 2020 prize. But before we do that, here's how the prize came to be.
So this has gone pretty well.
What first drew Barbara and David Roux to one another was counterintuitive.
It was our near complete lack of common interests that made us so compatible. I was from the north, she was from the south.
Yeah, he's very analytical, I'm not. And
I have no fashion sense. He's very stylish.
But opposites attract, and over the past 38 years, Barbara and David have become parents and grandparents. They've settled on a farm, and they've also settled on their philanthropic priorities.
several years ago, we really discussed between us some of the things that we felt passionate about: the environment, public health, education. And we have developed a better understanding of how we hope to contribute in those three areas over time.
We're, I think, naturally attracted to projects that look difficult, maybe even impossible, but which, if we can help them bring to fruition, can have large, broad-reaching, and profound impacts.
If we switch to looking at years of life lost.
Dr. Chris Murray proposed exactly that kind of project, a comprehensive database of world population health. Dave was captivated and signed on as a founding board member of the Institute for Health Metrics and Evaluation. He and Barbara sponsored IHME's Roux Prize as a means of highlighting extraordinary data-driven responses to public health issues.
We both felt that it was very important to recognize people that are doing very important work in public health, and important to recognize the people that are not as visible but are making very important contributions to this field.
There are public health heroes in every country, in every discipline, doing terrific work all over the globe. And this is a way of kind of shining a spotlight on some of them in order to let them tell their stories and inspire other people who are doing similar work.
Winners of the Roux Prize are awarded $100,000 US and given a medal rife with symbolism.
You can see the threads woven all around, which are meant to symbolize data flowing all around the world. And then secondly, you can see ripples showing the impact radiating out from this central core and touching people and institutions worldwide.
Having a worldwide impact is a defining mission for Barbara and David.
We've been fortunate to live in nice places, enjoy good health, and have access to education, so we know personally how valuable these elements can be, and we'd like to see as many people as possible and enjoy those same gifts.
Well, whether it's improving the lives of refugees on the Burmese-Thai border or fighting for better health outcomes in Rwanda, Mali, and the Philippines, whether it's rooting out the causes of violence in Colombia or fusing the very best elements of science and journalism, one thing all past recipients of the Roux Prize have in common is their extraordinary commitment to public service. Here are their stories. The streets of Cali, Colombia, are where the Roux Prize's inaugural laureate made his mark. An epidemiologist by training, Dr. Rodrigo Guerrero was elected mayor in 1992, determined to use data to tackle the city's high homicide rate.
In Colombia, was 15% of the gross national product was lost because of violence. And there was a time that we were using 6% of our GNP for education and 7% of our GNP for health. So we were losing by violence more than the combined efforts we are doing for health and education.
During 2 spells as mayor, Guerrero reduced the number of homicides drastically by analyzing the causes of murders and then placing restrictions on alcohol and guns, techniques that were copied throughout Colombia and across Latin America. The 2015 Roux Prize recipient, Dr. Agnes Bingawahu, returned to Rwanda shortly after the genocide of 1994, encountering a desperate situation.
When I came back in Rwanda, all the health sector was destroyed, but the entire country was destroyed. Nothing was functioning, no way to get medicine on time.
Bingawahu immediately recognized the value of data and, using IHME's global burden of disease, identified neonatal care and illnesses caused by smoke from wood stoves as priorities for healthcare improvement.
It's not that I'm interested in health data. I'm interested in knowing what I'm doing. And I'm interested in knowing how the world is working. And to know that, you need data, you need science.
Focus on 2 things.
Science is at the heart of John Wong's work.
What is the burden of each of the diseases that are prevalent here in the Philippines?
An epidemiologist and biostatistician, Wong was invited by the Philippine government to help it establish universal health care coverage, using disability-adjusted life years, or DALYs, culled from IHME's global burden of disease. Wong and his team identified the top causes of ill health in the Philippines, pairing them with the most cost-effective interventions.
Complications from prematurity has the 4th highest burden of disease in the Philippines, now as measured by DALYs. The cause of this is traceable to poor obstetrical care. No? So we need better antenatal care, we need better care during delivery, and also postnatal care.
Using data to determine health priorities and affordable interventions in resource-poor environments motivates many Roux Prize laureates. In Mali, one of the poorest countries in the world, Dr. Samba Sow established a laboratory to determine the causes of often deadly infections. Having identified pneumococcal infection and Haemophilus influenza type B, known as Hib, as major elements of the burden of disease, Sow implemented a vaccine program in conjunction with Gavi that reduced deaths from Hib by 80% in 3 years.
If you do surveillance, you demonstrate a high disease burden, and then you maintain surveillance, you introduce vaccine, and you improve some knowledge and skills at the clinic so that they can collect right data, you can save lives.
When conflict erupted between Burmese government forces and the country's Karen minority in the late 1980s, Cynthia Maung, a 3rd-generation Karen doctor, fled to neighboring Thailand. There, she set up a clinic treating other refugees, internally displaced people, and migrant workers. Noticing that their medical records had large gaps, she introduced the Health Information System, collating and computerizing data from all aspects of the clinic's work and emphasizing the importance of including all patients.
I mean, you have to have the standard life for all the people, regardless of the status or regardless of the man, woman, or so we have to make sure that everybody access to essential healthcare through the collaboration and network, but we cannot do alone ourselves.
At the opposite end of the medical data spectrum from handwritten originated records are the Lancet 16-journal family of publications. Under the leadership of editor-in-chief Richard Horton, the Lancet has embraced data as the bedrock for unashamedly promoting public health goals globally.
At the Lancet, what we've tried to do is to use the science we publish in two ways. First, as a means for advocacy, to try and draw attention to some of the most pressing health issues in the world and put them into the agendas of presidents and prime ministers. But also we want to hold those with political power accountable for their promises and commitments.
Though their life stories are very different, what each of the Roux Prize laureates have in common is their passion for improving lives by gathering and analyzing health data. Theirs is a mission guided by these words, often attributed to Galileo.
Measure anything you can, and wherever you cannot, make it measurable.
Previous recipients of the Roux Prize are a source of inspiration for anyone who cares about public health. And in just a moment, that roster of achievement will be expanded. Here to announce the winners of the 2020 Roux Prize are Barbara Roux and founding IHME board member David Roux.
Thank you, Angela. It now falls to me, with very great pleasure, to announce the winner of the 2020 Roux Prize. In a departure from tradition, this year's award is shared by two people, sister and brother, whose work epitomizes the values of the Roux Prize, touching the lives of millions of people all across the globe. This year's recipients are academics with a passion for public health that has led them to dedicate their careers to developing an open-source health data management platform used by major global health agencies in more than 100 countries. It is my very great pleasure to announce that the winners of the 2020 Roux Prize are Professor Jørn Braa and Professor Kristin Braa of the University of Oslo in Norway.
Congratulations, Kristin and Jørn. David and I could not think of more worthy winners of this award. Rest assured, we have your medals in our safekeeping and we'll be sending them to you very shortly. Congratulations again.
Jørn and Kristin Braa's impact on the collection of health data reaches into nearly every continent on Earth. How did this brother and sister team of scientists come to touch so many lives? We visited with them in Norway to find out. Jørn Braa is 7.5 years older than his sister Kristin, but from her very earliest childhood, she was a force to be reckoned with.
We always actually have had a very good relationship. I mean, even though I was pretty annoying, I guess, and I know, but we always have a good relationship.
Of course, she was so energetic that it was a bit tiring, of course, when I was young, and embarrassing and stuff like that, but after a few decades, you get used to it.
Kristin, like her older brother, poured her energy into the field of information technology in the pursuit of social justice.
Couldn't really imagine that we will end up working in this big, large grassroots movement. However, we both of us was very political active in the youth. And we both of us was believing in grassroots movement and kind of actionistic take on changing the world.
In the early 1990s, one place where the world was changing significantly was South Africa.
The aim was for the new government in Mandela's government in South Africa was to ensure equity in health services provision, but they had to have data to measure whether that equity was achieved or not. So that was the first purpose of the DHIS2 software.
Norwegian scientists working collaboratively with 2 South African universities developed software called the District Health Information Software, known today as DHIS2. It is designed to monitor the public health needs of individual communities, and through real-time, community-based reporting, an aggregate picture of a nation's public health needs emerges that officials can use to allocate resources. While other African countries noticed the South African example, and with the help of Jørn and his colleagues, adapted the software for their own use.
Let me introduce Bjørn, because Bjørn will now show something great, cool features.
Kristin joined the team in 2009 and runs the department which manages DHIS2.
It started off as standalone Microsoft Access software, and then it kind of traveled through geography and technology to become a web-based, cloud-based, mobile internet-based, become actually a platform. So we are actually working on a real implementation and learning from each implementation how to tweak the DHIS2 as a health information system platform for public health into a disease surveillance platform. From the Ministry of
Learning from the use cases and ensuring that those lessons are shared widely among the users is fundamental to the DHIS2 ethos.
Everyone ready for DHIS2 for education?
It's an open source platform that users are free to adapt to the specific needs of their countries.
Countries can start using it without initial barriers of thresholds of cost. In Senegal, with a little help, they started using the DHIS2 for COVID. They already know the DHIS2 for the other health services, but they were able more or less on their own then to train people all over the country, all health centers, via Zoom. If it had not been open source, it would not have been possible.
It's been adopted by health ministries in at least 73 countries, and Kristin and Jørn nurture its growth from their home base at the University of Oslo.
It's very, very important to emphasize that this is a we, this is not us. The role of the University of Oslo is actually, we are coordinating the software development there. We are providing PhD program. So we could say that it's a hub for providing global resources to enable implementations in the local area.
This brother and sister team has helped build a global network of health data covering 2.4 billion people, a third of the world's population. And while working with family can be challenging for some, for Kristin and Jørn, it's an advantage.
We can actually work together very well because we are complementary and we have very, very different personalities. But however, we always kind of form strategies, discuss the big things and actually agree.
And what they agree upon is the power of locally generated, data-driven solutions to public health issues.
Local empowerment and use of information for action at the local level and measurement for equity in health. That's actually the participatory design principles that is ruling our work even today.
There you come with the apples.
Apples.
Kristin and Jørn's collaborations range from the simplest of things to the most complex. They share a commitment to providing real-world solutions to real-world problems in real time. And in bringing their complementary skills to that task, millions of people the world over are reaping the benefits. Kristin and Jørn Braa's work is helping to facilitate better healthcare management everywhere. So we're taking you to a few key areas around the globe where the Braa's work is making a difference.
Hello, my name is Mark Dezelia, and I currently serve as the Information Systems Team Lead in the Coordinating Office for the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR. It's my great honor, my great privilege to congratulate Kristin and Jørn Braa on their receipt of the 2020 Roux Prize. PEPFAR began its collaboration with the University of Oslo and, of course, with Kristin and Jorn in an official capacity in 2014 when we adopted the DHIS2 software as the foundation of our facility-level data collection and analysis platform, a platform that has allowed this program to ensure that we're delivering the right services to the right beneficiaries at the right times. And it allows us to track our progress towards global HIV epidemic control. Jorn and Kristin have instilled this idea of a system being more than its component parts, knowing a system is, at the end of the day, it's some technology, it's some process, and it's the people. But it has been Jorn and Kristin and the community they've built around its focus on those people that sets DHIS2 apart. That emphasis on what an individual can become in their current role and in a role 10, 20 years from now, and moving this field ahead, that has allowed DHIS2 to be something bigger than software and has allowed people to get engaged and excited about using data at all levels, improving the system and the context around them. It is that spirit that has emboldened me to help our program do more and more challenging things year after year. And I truly, truly, truly want to thank Kristin and Jorn Braa for their contributions to this field, and again, congratulate both of them on their very well-deserved receipt of the 2020 Roux Prize. I can't think of a better brother and sister pair who deserve this award. Thank you.
Let me say a very big thank you to Kristin and Jorn Braa, and kindly allow me to extend my thanks to all his team. Since meeting Jorn Braa in 2010 in Accra and Kristin shortly after, both of you have become a part of WAHO. Jorn and his team have all traveled to Bobo Dioulasso and to World West Africa to support us in our mission, while Kristin has been very instrumental in assembling and managing the team to help us set a regional warehouse and subsequently capacity building on operationalization of the platform nationally and regionally. Today, all 15 ECOWAS member states are using DHIS2 in data management, which has dramatically improved the epidemiological information sharing via regional platform. As an acknowledgement of your contribution, the Director General of WAHO awarded in 2017 this certificate of recognition to honor your team and the important support you have developed in ECOWAS region to supporting the development of health information system. Let me say again, thank you very much and wishing you a very long and blessed life. Thank you.
I would like to congratulate the Braas. Congratulations, Kristin Braa. Congratulations, Jorn Braa. I'm proud of you. Wish you the best. And regarding the contribution of DHIS2 in Rwanda, it have contributed a lot. One is that it's now an integrated system that collects data across the public and private facilities. Secondly is that it's now very easier for us to visualize data up to facility level, so we can be able to monitor what happens to the facility. Secondly, it have improved the information used across the layers, which is the facility, district, and the central level. Another part is that it have improved the more focused actions, and again the planning, which is the resource allocations, and it's a flexible tool that you don't need to have programmers for it to be customized. And I also recognize the efforts towards training of training countries to own the system. And this one, that's why I really congratulate the Jorn Braa and Kristin Braa for their efforts towards the DHIS2 that is really contributing a lot in the countries. Thank you.
Well, now we are headed back to Norway, where in a few moments, we're going to hear from Jorn and Kristin Braa. And with us to introduce them is a woman who is intimately familiar with the breadth and power of their work. From Oslo, here is the Director General of Norway's Institute of Public Health, Dr. Camilla Stoltenberg.
Thank you, Angela, and good morning to you all from Oslo. It is a true pleasure for me to celebrate the winners of the 2020 Roux Prize, the two professors at the University of Oslo, a sister and a brother, Kristin Braa Jørn Braa. I nominated these two innovative computer scientists for their outstanding and visionary work in establishing a global system for disease surveillance and healthcare management. The Health Information Systems program, led by the two professors, has made it possible for low and middle-income countries to implement a low-cost data system, enabling countries to make the best use of evidence and data for public health. I have seen firsthand how the health information system has provided critical infrastructure for mother and child health in Palestine. I know that DHIS2 has played a crucial role in real-time monitoring of vaccination campaigns in Uganda. And I know that to date, 61 PhD students from the Global South have graduated within the Health Information Systems Program network. These are just a few examples of the bold and fantastic achievements by the two prize winners. So now it is my honor to present the worthy winners, Kristin and Jørn Braa. Congratulations.
So thank you all for these wonderful words, especially to you, Camilla, for actually nominating us. For Tommy Carr from the West African Health Organization and Andrew Muhire from Rwanda Ministry of Health for the great collaboration over the last 10 years. Also, thank you to Mark from PEPFAR to being very, very important, forming the partnership around investing in the DHIS2 as a platform. Been very, very important for us. But of course, thank you to the Roux, Barbara and David, for actually giving us this award. And this award is not for us, as we see it. It's actually an award for the whole community.
Yeah, we are honored, of course, of receiving the award, but the honor is shared with the community and all those that have been working together with us since the early days, the start in South Africa, more than 25 years ago. Actually, 26 years ago today, we started the HISP program as a formal part of the South African Reconstruction and Development Program, where the aim was to uplift the people who were suppressed and suffered during apartheid. And for the health sector, the aims of the RDP, as it was called, was to ensure equity in health and health service provision on the one hand, and on the other hand, to support the integration and decentralization of the new district health systems. In these two areas, information as measurement and as information for action and empowerment were very, very, very important. After many, many years of work in South Africa, around 2000, the HISP and the DHIS movement went on to spread in Africa, starting with Mozambique. It started with developing master programs, working with the different countries in East Africa and then in West Africa. And focus was on research and education, as well as developing information system to support the health services. In Asia, starting with India, where actually it started there with the first version of DHIS2 already in 2000, but the DHIS2, the web-based DHIS, was started in Kerala in 2004, and from there it went on in Asia to big countries like Indonesia and Bangladesh, but also, say, more smaller countries like Sri Lanka, Laos, PDR, and Vietnam, and Myanmar.
So this spreading through all these countries was actually the stepping stone to the movement that we see today with 15 HISP groups. And these HISP groups are very often led by people that have taken a PhD within the HISP program. So this is just, it's also not only software development and becoming a platform through developing this potential with the mobile internet and open source software and Android as a point of data capturing, But it's also an action research program where people build their career and their education through this program and later have a career in their home country, in the university, in the ministry, or actually forming a HISP groups. So as to date, we have 15 HISP groups that form these spaces. So people have asked us, how could we respond so quickly to the pandemic of the COVID-19? And that is because of this movement of 15 HISP groups that's already leveraged on the implementation of DHIS2 in the country. There is educated people and ownership in the countries. They use the DHIS2 for health information system. And then innovations like the Sri Lanka started already in 29th of January, 2 days after the first suspected cases come to the airport. They were able to configure an app for a port of entry solution for tracing the suspected cases in Sri Lanka. And that formed the startup with sharing through the HISP groups, leveraging all these countries that already used DHIS2 to be able to, 15 of March, actually launching together with WHO, based on the standard indicators, 4 packages on surveillance of the COVID-19 pandemic. So this is possible because we already worked digital. We are already one big family that we work together with software development, having always innovating to be able to meet the use cases in the local area, and then again bringing that back with software features, but also with capacity, with guidelines and the way of doing it in a good way and inspire each other. So to conclude, it's a great honor for us, on behalf of the community, to receive this prize. So thank you so much.
Kristin and Jørn Braa have devoted their careers to promoting data-driven responses to public health crises. Their commitment to this cause has been relentless, and it's a commitment that we share here at the Institute for Health Metrics and Evaluation. Joining us with some thoughts on that is Dame Sally Davis, IHME board member and master of Trinity College, Cambridge.
What a pleasure to welcome to the family of Roux Prize laureates, Kristin and Jørn Braa. It's a great family who are a network of people whose work uses data in so many different ways to make a difference to health, locally, nationally, and globally. The Braas' work actually follows and reflects the same principles as the Institute of Health Metrics and Evaluation. After all, the IHME delivers timely, relevant, and scientifically valid evidence to improve health policy and practice across the world. The Roux Prize has, once again, shed a light on the importance of powerful global health data, while the work of the IHME in forecasting trajectories of global COVID-19 shows how data can be used by healthcare providers and public health to make a difference in the broadest sense. We all hope that next year the Roux Prize ceremony will be back at the Guildhall here in London. But our only certainty is that the next winner or winners will, like Kristin and Jørn Braa and the IHME, be passionately committed to the great purpose of improving population health through the collection and interpretation of the very best data. Thank you.
All right, thank you, Dame Sally. Joining us now are 3 people who have dedicated their careers to the purpose that Dame Sally described. From Oslo, the winners of the 2020 Roux Prize, Kristin and Jørn Braa. And from here in Seattle, Dr. Christopher Murray, the founder and director of the Institute for Health Metrics and Evaluation. Chris, over to you.